University. I hope you all are doing fine and I hope you all are ready for today's class. And unfortunately, we have no way to communicate whether the lessons are being clear to you or it is not clear to you. If you have any doubts, any questions, unfortunately, it is a one sided communication, which teachers like me do not like because class has to be interactive, but due to various obligations, probably this is how the class has been shaped this way. I'm trying to do my best, friends, so that the topics become clear to you. At least you get a broad perspective of what this paper is all about. And this paper, as you know, is talking about women's health issues and concepts. And we are coming at the fag end of the discussion of our 16 unit syllabus. And yesterday, we started discussing innovative approaches in community health. So yesterday we saw a few videos about ASHA workers, right? How important role they are playing. And whenever you talk about the grassroots level health infrastructure and health care delivery systems, you cannot complete your discussion without talking about ASHA workers. So that critical is their role. And we also saw something on telemedicine. So as technology is increasing and empowering our healthcare, my dear friends, we are seeing that various models of telemedicine and virtual consultations, robotic surgeries, a greater usage of artificial intelligence has started. So, because it is an online class, the online class has its advantages and sometimes it also has its disadvantages, right? So let us not worry about the disadvantages. Let us try to make best use of whatever is possible. And today I will begin our class by sharing one very interesting video with all of you. And this video, let me tell you, my dear friends, one second, yeah. This video is not of India. Okay. So now you might think that, okay, why you should be seeing a video which is not of India? This paper is related with India and things like that. Yes, agreed. This paper is related with India, and we should have all details about India itself. I'm trying my best to cover India-based videos also. But this video, why I'm showing it to all of you is, it is about 5 minute video for all of you to develop a perspective that whenever you're talking about health, and right now, you remember we are talking about major healthcare systems in India, and we are also clubbing it with the topic of innovative healthcare systems. So, until and unless you don't talk about community participation and community involvement, and none of the healthcare systems can be successful. So I will not share more. I will not talk more. I want you to see this video first, and then we will go ahead with our discussion. So this is 5 minute 39 seconds video, and I hope you are able to see it. So, friends, I hope you liked this video. See, basically, why I showed this video before I started our discussion, there are two reasons for that. First reason is I'm sure you are able to relate to this video and the video what we saw on ASHA workers yesterday, right? Because in that also we are seeing that how ASHA workers, they are basically community level health workers and whose contribution in women and child healthcare system is phenomenal, right? The second thing which I wanted to impress upon all of you by showing this video is not only in India but globally. Now you see, the video basically is based at in an African country, but community health worker system is being implemented in various underdeveloped countries also. And one very clear takeaway message from this video is like, especially because we are talking about the paper on women health issues, right? So whenever we are talking about women's health issues, childcare health issues will be part and parcel of it. So we will be able to minimize the infant mortality rate and maternal mortality rate. And you remember there was one statement, every child has to have the fifth birthday, because you might wonder that what is this statement, but believe me, there are many countries in the world whereby kids are not able to see their fifth birthday because of the lack of hygienic and lack of proper nutrition to those kids. And that is why healthcare should be seen also from the perspective of a human right and just not, some additional right. And that is why in all our discussions so far, we were trying to discuss about how the war in Russia and Ukraine is impacting the healthcare for women and children, how the challenges in Philippines and between Israel, how not Philippines, Palestine and Israel is impacting the people, especially the women and children. So we have to understand women's health not only from the point of view of the children, but also from the point of view of the entire ecosystem in which they are operating. Now, let me share the screen where we will continue with our discussion. And in today's class itself, I will also share with all of you another very interesting video on artificial intelligence, because the topic what we are talking about innovative approaches in community health. So this slide we discussed in yesterday's class, that how digital health and telemedicine is coming in a large way. And see, when you are bringing in, I'm sorry, when you are bringing in technology in such a large way, you should also ensure and facilitate that technology is, its benefit is going to the grassroots level. And that is where we are able to use the ICT and mobile technology in various applications connected with digital health and telemedicine. We were also trying to talk about community health workers. So just now the video, what we saw is also related with this particular point. And please also see it in the connection of our earlier class where we have discussed about ASHA workers also. So community health workers and peer educators. So you are trying to provide all kind of training, and you are equipping the local community members also with regard to healthcare, health education, and disease prevention services also. In this connection, if I'm not wrong, probably sometimes you have this recall issues, right? Few months back, I was seeing one program on Doordarshan where they were talking about one Dr. Banga, I think. There is a couple doctor in Chhattisgarh area whereby they took a decision that they will commit their entire lives towards the healthcare of the tribal community there, and they started one foundation called as Hope. So when they started working there, the infant mortality rate and maternal mortality rate was very high. And just with the presence of two doctors, I don't think you will be able to make a major difference to the entire community. So those two doctors, they started training people on basic course, like checking the temperature, or in case there is a dehydration, how to administer any kind of electrol or ORS kind of fluids to the child or to the mother, how delivery can take place in a hygienic environment, how to maintain the child's health and mother when she is pregnant. So when they started introducing all these things, there was a drastic reduction in maternal mortality rate as well as infant mortality rate. I'm not able to recall the exact name. This is a doctor couple, and they have they adopted some tribal place in Chhattisgarh area. To be more precise, in Dantewada region, if I can recall right. So community, until and unless you are not involving community, especially when it comes to tribal communities, rural communities, and you will not be in a position to prevent the diseases. So by involving the community, we are not only bringing awareness, we are not only educating them, but we are also facilitating that primary care is being provided. Peer educators means what? Same age group, you're trying to educate people on substance abuse, which is drug addiction, HIV, AIDS, like see even how to prevent oneself from HIV, and in case like if someone is infected with the virus, still a normal life can be led by proper medication and things like that. And because mental health issues are increasing to a great extent, even peer group, same age group, we will be able to share so many things with our peer members. Then a lot of innovation is also happening with regard to health information. Okay, and you might have come across, like whenever you're talking about artificial intelligence, there is also a branch called as data analytics. So data analytics means what? Whatever data you have, how are you going to analyze that data for preventive measures? And also, how are you going to analyze the data to understand the trends connected with a particular problem? And that is why you have a greater uh, efficiency when you have huge amount of data. Today a lot of software programs are there, so many apps are there, so many research data related specific apps and softwares. They are helping us to analyze massive data in very very simple way. So electronic health records means you are able to maintain health records electronically. You don't have to carry your entire paper of your medical reports. So this is implementing EHR systems to streamline patient data management, improve care coordination, and enhance the accuracy of health information. Information is power. That is what last 20-25 years we are listening after IT revolution. So health related information, if it can be collated properly, it can go a long way in making health related policies also. So big data and predictive analytics, this is also very interesting innovation in the field of community health. So in this, what are we doing? As I mentioned, we are providing a kind of a health analytics to identify the health trends, predict disease outbreaks, and allocate resources more effectively. For instance, predictive models can help in planning vaccination campaigns and managing public health emergencies also. Friends, I would like you all to go back during COVID time You remember during COVID time, there were different waves, first wave, second wave, third wave. So many professors from IIT, they were also trying to have a kind of a mathematical model. And of course, there was support from other health related, research related agencies also. They were trying to develop a trend that now in which place maximum number of cases are there, when there will be a peak, and after that peak how there will be a downfall in such kind of COVID related cases. So this could be done, a kind of a predictive analysis could be done, and that helped the government also. I'm not very sure to what extent government was depending its action on such kind of predictive analysis. I'm not updated on that. My apologies for that. But as far as I can recall, a lot of discussion on media channels, they were trying to show this also. So now, if this models to a great extent, it could help us to understand that by when there will be a peak. So when you are able to predict that, okay, this particular emergency is likely to reach at peak in next 1 week or 2 weeks. So we have to gear up with all kinds of required medical devices. And when we were fighting COVID, oxygen, especially second wave, was very, very critical phase because of the lack of oxygen. And you might also have heard about infections like black infections. So a lot of effort was done. So if you have right kind of data, okay, you are in a position to do lot of prevention, and you are also in a position to do prediction with lot of precision also. And in fact, in Arogya Setu also, when we were entering our data, the entire data was being collated at a national level, right? So data can play a very important role. And this is a beautiful innovation, I would say, in community health, because you are using technology to improvise people's lives. Then community-based participatory research. What is this? Let us try to understand. So engaging community members in research. You are directly engaging the community members in different kinds of research. So you are designing, implementing and evaluating the health research projects to ensure that interventions are culturally relevant and address community specific needs. See, to put it in more simple language, if I am involving, let us say I'm a I'm a medical professional and I'm doing some research on some kind of let us say diarrhea, okay, or tuberculosis in particular region of our country. So now that region is showing a serious outbreak of TB cases when compared to the other regions in India. And as a medical professional and as a researcher, I'm doing a research to find out that why it is happening in this region only. Okay. So what I will do, if I want that, okay, once I'm able to find out the data, final results, then some intervention also I will be doing. So if I am involving the community from the beginning only, because see, medical care, though is a very distinct part of social life, we cannot deny that cultural factors play a very important role. Okay, so if you are involving the community in designing your entire medical research and you are evaluating the causes that why in this particular region more TB cases are taking place, then tomorrow when you are involving the community, you as a researcher also become familiar with, okay, what are their cultural sensitivities? What are the cultural obstacles? If as a medical researcher and later as a policy maker, if you want to implement a particular intervention there and that is not in accordance with the culture of that region, you will not be able to implement that. And that is why involving community, it becomes very, very important. And this model of participatory research is more effective. Collaborative problem solving, so working with community stakeholders to identify health priorities, develop interventions, assess outcomes, fostering a sense of ownership and sustainability. When you are involving a community, when you are involving different members of the community, then the community is also developing a sense of ownership that yes, we all are responsible for our health conditions. We all are responsible to ensure that hygienic conditions have to be maintained. And once the entire community is taking that ownership, okay, they will make lot of efforts to ensure that it sustains. Now, let us say you're not having any kind of community ownership. Everything is being dictated by the government. All right. So when everything is being dictated by the government, what happens? We just become one passive listener. అరే ఏదో వాళ్ళు చెప్తుంటారు అబ్బా వాళ్ళు చెప్తాము ఒక చెవితో వింటాము వేరే చెవితో తీసేస్తాము. You listen with one ear and you remove it from the another ear. Right? So when you are involving the community, you also take the ownership, and such kind of efforts, collaborative efforts, it will help us to not only solve the community health related problems, but it also will make sure that these practices are sustainable in nature. They can continue for a longer time. I hope I'm making sense of these points, my dear friends. Right. There is one more brief video which I will show you after some time, that is on artificial intelligence. And then innovative funding and partnerships. You all will agree with me that funding is one very important factor in entire healthcare system. And in yesterday's class also, day before yesterday's class also, if you can recall, I was talking about systemic constraints, right? Where, funding is one important factor there. So how we can uh, make our funding also innovative? Because everything and top to bottom, if you are expecting government to take care, it is not possible. In fact, in one of my classes, when I was showing you that video, in that video also it was mentioned that almost 61% of spending on health is by the individual himself or herself. And when we are going to talk about the last unit, new economic policy and health, we will understand that after 1991, when the policies of economic reforms and especially LPG, liberalization, privatization, globalization was announced, even privatization of healthcare also took place. And after that, government spending on public health infrastructure reduced. And in many cases now, because government cannot completely withdraw, and at the same time, you cannot allow only private sector to constantly keep thinking only about profits. So that is why we have a very interesting model called as public-private partnerships. So here there is a collaboration with private sector partners because private sector has a better technological outreach also there is possible. So they will bring their expertise. Public sector will bring their expertise. There is a merger of both the expertise and we are able to perform better on the ground. Crowdfunding and microfinance. Utilizing crowdfunding platforms and microfinance to support health initiatives, especially in resource limited settings. So wherever resources are limited, you are, mobilizing funding from people, right? And also microfinance, wherever possible, you are doing micro level savings to facilitate that better saving can be done and that saving can be used as funding for necessitating better spending in the especially public sector healthcare system. And apart from innovative funding and partnerships, we also have behavioral and mental health innovations. So what are this now? As I think at some point of time or the other, we have spoken that after COVID, lot of emphasis is there on mental health, right? So, as part of this, what is happening? Tele-mental health services. So, we are providing remote mental health services through telehealth platforms to increase access to care, particularly in areas with a shortage of mental health professionals. Now, we should not be under the impression that all kinds of mental health challenges happens only in urban areas, and in urban areas we already have large network of psychologists, counselors, psychiatrists. And now the mental health concerns can happen with anybody and everybody. But even today, I'm sure you all will agree with me that in rural areas, in tribal areas, people are hesitant to talk about mental health issues. They think that any kind of a mental health issue means the person is mad and he has to be put in some kind of a asylum, mental asylum. So now you might have seen also lot of online counseling platforms are also there. It's only matter of exploring them. And also now I think even in villages, like you have smartphones, right? So the moment you have smartphones, you are connected globally with all kinds of platforms. And in today's time, language is no more a barrier because technology has facilitated. You can choose language also. So tele-mental health services can be used drastically to also address the cognitive issues, mental health issues, and behavioral issues also. And this is a great respite and great support to ensure that mental health care is also provided. Community support groups are also available where we are talking about establishing peer support groups and community-based counseling services to provide mental health support and reduce the stigma. See, friends, especially in rural areas and tribal areas, with regard to mental health, lot of stigma is attached. As I told you, some mental health concern, some person is depressed or has anxiety, means he has to be, he's mad and he has to be taken to mental asylum. Lot of stigma is attached. So when you are working or when you are initiating such kind of community support groups, you are in a position to reduce that stigma also to a great extent. Then environmental health interventions. You might think that, okay, how this environmental health intervention is connected with community health. So just go back in one of my classes, I was mentioning that World Health Organization has said that 80% of the diseases are because of consuming polluted water, right? And it is fact also. So if the sanitation practices are not being followed, lot of unhygienic environment is there, water is not clean, it is highly polluted. In such kind of a situation, you are opening your door for all kinds of waterborne diseases, right? And pollution control programs here also, again, you're involving community. So community initiatives to reduce exposure to environmental pollutants and promote healthy living environments, right? Then let us proceed further. I think we have, right. We have two more slides where we are going to talk about this topic, and then I will show you that very short video on artificial intelligence. Now, I do not know all of your background. If any of you are from engineering background and you're still thinking that what you should do in your masters, you can always think of exploring AI related courses. And again, I think I just read a couple of days back that we are starting, we, I think central government or state government, I'm not able to recall, there is an online skill-based university exclusively dealing with artificial intelligence. So, if you are becoming familiar with AI, AI can be used in multiple fields of education, healthcare, environment, voting, so many areas. So now one more approach with regard to how innovation is becoming part of community health is help desks. Okay, so help desks and kiosks are user-friendly innovations transforming primary healthcare in India. Positioned in healthcare facilities like hospitals, clinics, and community centers across the country, these digital interfaces offer several key benefits. So there is a help desk. Okay, so with these help desk or what you call as kiosk, they can play very, very important role in this. So help desks help in providing guidance and information. So they provide valuable healthcare information, helping patients understand their health needs and also treatment options. So, like, there can be multiple options related with any kind of wellness program or any kind of disease. So in that connection, all kind of guidance and information is provided. And appointment booking, patients can schedule appointments easily, reducing wait times and ensuring timely care. Payment and insurance services. These systems simplify financial transactions and insurance verification. In case if someone has been hospitalized, okay, how do you ensure, how do you facilitate that, the hospital is informed about insurance just with, if you show them the insurance card, remaining part the hospital administration can take care. Multilingual support. Now in a hospital, people from all backgrounds come. Everyone need not may not be speaking English, or like let us say in Telangana, all might not be speaking Telugu, all might not be speaking English. Some people can be speaking Hindi, Gujarati, Marathi. So for a multilingual support also, language barriers are broken by this help desks or kiosks. Accessibility, these these are very, very accessible and easy to use, and they are in a position to cater to people with varying levels of digital literacy. So even if your digital literacy is at minimal level, you might have seen, friends, you might have seen that most of these online help desks also, like let us say if I want to book an appointment at Kim's Hospital in Begumpet, I can go to their website and it is very, very easy for me to use that. Okay, so by that what is happening, you are able to book your appointment before, and you are able to save your time. And I might not be very tech savvy, highly knowledgeable in computer systems, but these help desks, these kiosks are so simple, so self-explanatory that you will be able to use it. Health promotion. So health desks or kiosks, they also facilitate in lot of awareness about different kinds of health lifestyles, or what kind of preventive measures can be used to address a particular health challenge. So this is one very interesting, innovative approach in community health. And right. Now, this slide is not giving us lot of information. In a way, it is repetitive of our earlier slides only. But what I'm basically trying to impress upon all of you is, if the government, which especially Ministry of Health and Family Welfare, both at central level and state level, along with the support of civil society organizations and various other NGOs who are working at grassroots level, we can go that extra mile to bring more and more awareness even among the most marginalized communities. See, people who are living in remote tribal areas, remote villages, who might not have exposure of how to deal with such kind of challenges. So, if we are able to use technology, we are able to use the government agencies, we are able to use digital technology, then lot of drastic change can come in the field of community health system. So I think there has to be a constant brainstorming, constant brainstorming, that how with latest technology, latest ways of reaching out to the community, how we can make sure that community health is of the best quality and it is easily accessible. So here, digital technology and awareness can play a very, very important role. And that is, in fact, in this entire slide, we are only talking about mostly about role of technology, and the role of technology can help us in behavioral change, communication for maternal, newborn, and child health services, vaccination, diabetes care, reduction of cardiovascular risks, telepsychiatry. See, you are able to have online telephonic psychiatric sessions, counseling sessions to address any kind of mental health issues. But only thing is, we need to integrate all these things. You need to integrate technology with the community involvement, the governmental support, and civil society organizations. So now that we have completed discussion on this innovative approaches, my dear friends, I would like to show you one very brief but very interesting video on artificial intelligence. Now, this video is actually talking about the startups, because India is in a massive way encouraging, Indian government is encouraging in a massive way about startup initiatives. So this video is talking about 5 startups about artificial intelligence in healthcare. So using this video, what my goal is, you should be able to understand that how artificial intelligence can help us to understand various health constraints, and that can be one remarkable innovation in healthcare system and community health in particular. So let me stop this screen share, right? And then I hope you all are understanding. And every time I'm feeling that gap, that we are not able to contact each other. There is no direct communication. I would request the concerned decision makers of Ambedkar Open University that from next time they should facilitate this interaction, so that, see, any time, any class, even if it is 10 classes also, one class also, 5 to 10 minutes of interaction is very, very important. So I hope, yes, screen is still loading. Yeah, now it has loaded. Now please see this video, my dear friends. So, see, friends, basically, with the help of this video, I was only trying to tell all of you that AI is coming in a big way in healthcare system. It is just not about the course. In fact, there is one more video also, because we have some time. I would like to show it to you for just a second, because that will give you a thorough understanding about uh, how. Okay, that, one second. I'm still thinking whether I should show you that or we should go ahead with the discussion. I'm still, one second, please. In the meanwhile, let me that AI video I will show you tomorrow. There is one more innovation. This is again because the lesson is about innovation. I would like you all to see. Some of you might have already heard about it, but I want you all to see this and understanding that what is this concept. This video is about doctors without borders. So this is another global level innovation in community health, which is playing a very, very important role. And as I told you, the only reason for me to show you these videos is seeing is believing, right? When you see things, you believe it. So you should see and try to understand that healthcare is expanding massively, and after globalization and with more and more new technologies coming up, especially data analytics and artificial intelligence, there is tremendous scope for us to improvise community health and reach out to the poorest of the poor with very little economic support. That is the power of the technology. Now, this is the last video for today's class. Yeah. So I hope now here I was only trying to impress upon you that 1 second, 1 second. I was only trying to impress upon all of you that how important it can be to work in the medical care, and especially when we are talking about community health. The globalization is bringing us more and more experiences. Now, you might have heard about Indian peacekeeping forces under United Nations, right? So, under United Nations peacekeeping force, many contingents from Indian armed forces also, they go and they offer their like they are part of that peacekeeping. And just recently, I think 2 3 days back, Major Radhika Sen is receiving the award for some distinction for her services during her stay in Congo. S- I think earlier one got award for Congo. She was in some other conflict hit zone. So imagine, especially several parts of Africa where there is constant ethnic violence going on, how difficult it is to maintain community health, how difficult it is to provide all kinds of medical services. In such kind of a scenario, Doctors Without Borders are working. So basically, friends, the purpose of me showing all these videos to you is only to give you a larger perspective that uh, health services is much, much beyond your textbook material. Okay. Community health has tremendous scope to make a difference. So far, we have discussed our 14 lessons. We have completed our discussion. So just because we have some time, let me quickly revise what all we have done. And so we started with discussing about major demographic parameters and what are its implications for women. Then we spoke about concept of nutrition and balanced diet, how important it is and how critical it is, an important component of maintaining good health, nutrients in the foods. Then we also discussed about what can be the different dietary requirements for different age groups. Especially, we try to differentiate between pregnant women and lactating women, and also the elderly women. Then, what are the common nutritional problems? We discussed about the PEM, where basically where, because of the protein, lack of protein, what kind of conditions develop, and lack of calcium. Then we went on discussing about nutritional programs for women and children. Then we also had a discussion on anatomy and physiology of reproduction, and we also discussed what are the important gynecological problems there. We try to talk about menstrual cycle, pregnancy period, and postpartum, that is after delivery. And then we also had discussion on pregnancy related problems. So with regard to pregnancy related problems, we were trying to discuss how the problems vary in first trimester, second trimester, and the third trimester. And at the time of delivery, there could be a possible risk of bleeding, and that is why a lot of care and caution is required. And we had a discussion in Unit 9 about various birth control methods. What are the common health problems which usually women suffer, which we discussed in Unit 10. And then we had a discussion on how environment and health are related. And here we try to distinguish between rural environment and its impact on health, urban environment and its impact on women's health. And last 2 3 days, we are discussing about two topics which we discussed in a way interchangeably, because these videos which I was trying to show cater to both these topics: major healthcare systems in India and innovative approaches in community health. So with this, we have completed our 14 units. And now I just want to introduce you to the topic health, policy, and women. Now, if you were with me in all these classes so far, see, health, one point of time, it is our individual responsibility. Okay, that I am responsible for my health. So I have to take balanced diet, I have to maintain healthy lifestyle, I have to do physical exercise, I should not have any kind of habits. That is my individual response. Then my family, I'm also responsible for my family's health, and family is also responsible for my health, whereby we try to regulate if any unhealthy practices our family members have, right? Now, beyond this individual and family, government also has a very important role to play. Now, why government intervention is very important? Because health as a indicator is very, very critical component of development. In fact, under Human Development Index, very, very important factors like infant mortality, maternal mortality. And by now, I'm sure you have developed that clarity that infant mortality, maternal mortality, these are straight away connected with the socio-economic background of the pregnant woman and the mother who and the woman who is delivering the child. Right. See, if one is in a very well-to-do situation, you have access to all kinds of medical checkups. You are getting done your delivery in a decently good hospital. But imagine people who are living in remote areas, below poverty line, whether they have access even to government hospitals or not, what is happening to them, right? So when you're talking about uh, women's health at a community level. So, individual responsibility, family responsibility, and also at a community level. So, when we are talking about community level, that is where health related policies become very, very important. Because what is government thinking? Now, when you talk about health policies, it is also connected with the Constitution of India. So now you might wonder that, Vinita, how is this connected? This is simply connected by Part 4 of India's Constitution, which talks about directive principles. And apart from that, various other articles are also ensuring that, everyone, in the videos also we are saying, that health should be a human right. So Part 4 of the directive principles of India's Constitution, they say they give directives to the government to enact all such legislations which will facilitate the welfare of the people of the country. And again, this directive principles is for everybody, every citizen. It's not that only one chunk should get the benefit. So directive principles are the directives to the government to make policies, to make welfare schemes, which is important for the health benefits of its citizens. So that is why health policy becomes very, very important. Now that time is closely approaching and I don't want to end abruptly, so I will rest my class today, my